Amy Sylvia is an active 30-year-old athlete, but about a year ago during a game of soccer, one moment changed everything.
I was running up to challenge for a ball on a 50-50 ball, and the other player came in and collided with my left leg, and then it basically made a very loud snap.
The diagnosis, every athlete's worst nightmare, a torn ACL. That's when she connected with Mercy Medical Center Dr. Mark Slabaugh.
She's very, very active, wants to go back to soccer. She says she was playing either 4 or 5 games a week, and those type of patients, because of her age, because of her sex, and also because of the desired sports that she wanted to play in the future, we said she's a perfect candidate for this.
The procedure is called LET, or lateral extraarticular tenodesis.
We take a strip of that fascia and then we put it under one of the ligaments called the lateral collateral ligament and then dock it into the bone, and that provides 2 points of fixation in order to decrease the risk of them having what's called a pivot shift.
Dr. Slabaugh says he's doing these procedures more often, and with it comes a little extra time under anesthesia and a bit of a larger incision like you can see on Amy's knee.
So I actually put weight on it the first day I got home. So I was only on crutches for maybe 2-3 days, and most of the time I was only on one crutch.
Not even a year later, after putting in the work in physical therapy, Amy is back to playing the sport she loves. Dr. Slabaugh says it's important for young female athletes to do different activities throughout the year and change it up so you're less likely to cause an injury from overuse of the same body parts. In Baltimore, Lacey Griffith, WBAL, TV 11 News.